One of the most dangerous and least discussed effects of diabetes is what it does to blood vessels. High blood sugar doesn't just affect glucose levels. Over time, it damages the delicate lining of arteries, reduces circulation, and increases the risk of complications like nerve damage, heart disease, and poor wound healing. What many people don't realize is that a specific mineral plays a critical role in protecting blood vessels, especially in people with insulin resistance or diabetes. This mineral helps regulate blood flow, reduces oxidative stress, and supports the inner lining of arteries so glucose and nutrients can move more efficiently through the body. The problem is that many diabetics are deficient in this mineral, or they're getting it in a form that doesn't absorb well. Without enough of it, blood vessels become more rigid, inflammation increases, and circulation slowly worsens, even if blood sugar numbers don't look extreme. In this video, we'll break down how diabetes damages blood vessels, why this mineral is so important for vascular health, and how using it correctly can help protect circulation and reduce long-term complications. Let's start by understanding what high blood sugar actually does to your blood vessels over time. Diabetes affects far more than blood sugar numbers. One of its most serious and long-term effects is damage to blood vessels. This damage happens slowly and quietly, which is why many people don't notice it until complications appear. High blood sugar repeatedly exposes the inner lining of blood vessels to excess glucose, triggering a chain reaction that weakens vascular health. The inner lining of blood vessels, called the endothelium, plays a critical role in regulating blood flow. It helps blood vessels relax and constrict, controls inflammation, and allows nutrients and oxygen to reach tissues efficiently. In diabetes, chronically elevated glucose damages this lining, making blood vessels less flexible and more prone to inflammation. When glucose levels remain high, sugar molecules attach to proteins and fats in the blood through a process called glycation. These advanced glycation end products stiffen blood vessel walls and interfere with normal signaling. Over time, vessels lose their ability to widen properly, reducing circulation to muscles, nerves, and organs. Oxidative stress is another major factor. High blood sugar increases the production of free radicals, which damage cells and tissues. Blood vessels are especially vulnerable to this damage. Oxidative stress weakens the endothelium and accelerates inflammation, further impairing blood flow. As blood vessels become damaged, the body responds by increasing pressure to push blood through narrower, less flexible pathways. This contributes to high blood pressure, which places additional strain on already weakened vessels. Poor circulation then makes it harder for glucose and insulin to reach cells efficiently, worsening insulin resistance. This damage does not happen overnight. It builds gradually, often over years. Many people assume complications only occur when blood sugar is extremely high, but vascular damage can progress even with moderately elevated levels, especially when insulin resistance and inflammation are present. Once blood vessels are damaged, blood sugar control becomes more difficult. Healthy circulation allows glucose, insulin, oxygen, and nutrients to move efficiently throughout the body. When blood vessels are stiff or inflamed, this delivery system breaks down. Poor circulation limits how effectively insulin reaches muscle cells. Even if insulin is present, it may not reach tissues efficiently enough to move glucose out of the bloodstream. This creates a situation where blood sugar remains elevated despite insulin being available, deepening insulin resistance. Blood vessel damage also affects the nerves that regulate blood sugar. Reduced blood flow to nerves impairs their ability to signal hunger, fullness, and glucose needs accurately. This can contribute to unpredictable blood sugar swings, cravings, and fatigue. In the extremities, reduced circulation slows healing and increases the risk of infections and ulcers. This is why foot and nerve complications are common in long-term diabetes. But circulation problems don't stop there. They also affect the heart, kidneys, and brain. Inflammation within blood vessels further worsens insulin resistance. Inflammatory signals interfere with insulin receptors and disrupt glucose uptake. This creates a vicious cycle where high blood sugar damages blood vessels, and damaged blood vessels make blood sugar harder to control. Protecting blood vessels is therefore not optional in diabetes management. It's foundational. Improving circulation, reducing oxidative stress, and supporting endothelial function can make glucose control more stable and reduce the risk of long-term complications. Another overlooked issue is nitric oxide signaling. Healthy blood vessels rely on nitric oxide to relax and allow proper blood flow. High blood sugar and oxidative stress reduce nitric oxide availability, causing vessels to remain constricted. This not only raises blood pressure but also limits nutrient delivery to tissues. When nitric oxide signaling is impaired, circulation suffers even further, and vascular damage accelerates over time. In the next section, we'll focus on the specific mineral that plays a key role in protecting blood vessels, why diabetics are commonly low in it, and how it supports circulation at the cellular level. The mineral that plays one of the most important roles in protecting blood vessels in diabetes is magnesium. Magnesium is involved in hundreds of biochemical reactions in the body, but its role in vascular health is especially critical for people with insulin resistance or chronically elevated blood sugar. One of magnesium's primary functions is regulating blood vessel relaxation. Blood vessels need to widen and narrow constantly to control blood flow and pressure. Magnesium acts as a natural calcium regulator. When magnesium levels are adequate, it helps prevent excessive calcium buildup inside blood vessel walls, allowing vessels to stay flexible and relaxed. When magnesium is low, calcium accumulates, vessels become tighter, and blood pressure rises. This matters because stiff blood vessels are more vulnerable to damage from high blood sugar. Reduced flexibility increases mechanical stress on the vessel lining, accelerating endothelial damage. Magnesium helps preserve this flexibility, reducing strain and protecting the inner lining of arteries. Magnesium also supports nitric oxide production, a key molecule that signals blood vessels to dilate. Nitric oxide allows blood to flow smoothly and efficiently through arteries. In diabetes, nitric oxide availability is often reduced due to oxidative stress and inflammation. Magnesium helps restore this signaling, improving circulation and oxygen delivery to tissues. Another critical role of magnesium is its effect on inflammation and oxidative stress. Chronic low-grade inflammation damages blood vessels over time. Magnesium helps regulate inflammatory pathways and reduces free radical production, lowering the oxidative burden on vascular tissue. Importantly, magnesium deficiency is extremely common in people with diabetes. High blood sugar increases magnesium loss through urine, meaning diabetics often lose magnesium faster than they can replace it through diet alone. Over time, this creates a deficiency that quietly worsens blood vessel health. When magnesium levels are low, blood vessels are not the only systems affected. Magnesium deficiency also worsens insulin resistance, creating a feedback loop that accelerates vascular damage. Magnesium is required for proper insulin receptor function. Without it, insulin signaling becomes weaker, glucose remains elevated longer, and blood vessels are exposed to damaging sugar levels for extended periods. As blood sugar remains elevated, glycation increases. Sugar molecules bind to proteins within blood vessel walls, making them stiffer and more prone to inflammation. This process compounds faster when magnesium is low because antioxidant defenses are reduced and repair mechanisms slow down. Poor magnesium status also affects the nervous system. Reduced blood flow to nerves combined with impaired nerve signaling increases the risk of numbness, tingling, and pain, especially in the hands and feet. These nerve symptoms are often early warning signs of vascular damage. In the heart, magnesium deficiency increases the risk of rhythm disturbances and contributes to higher blood pressure. In the kidneys, reduced blood vessel health impairs filtration. In the brain, reduced circulation increases long-term risk of cognitive decline. These complications are not caused by blood sugar alone. They are driven by the combination of glucose damage and mineral imbalance. What makes magnesium especially important is that its deficiency often goes unnoticed. Blood tests may not always reflect intracellular magnesium levels, meaning many people appear normal on paper while tissues remain depleted. Restoring magnesium does not instantly reverse damage, but it slows progression. It improves blood vessel flexibility, supports nitric oxide signaling, reduces inflammation, and helps insulin work more effectively. Over time, this reduces the stress placed on vascular tissue and lowers the risk of long-term complications. In the next section, we'll discuss how to get magnesium correctly, including food sources, supplement forms, dosing considerations, and common mistakes that prevent it from protecting blood vessels effectively. This mineral protects blood vessels by supporting several core systems that are directly damaged by diabetes. One of its most important roles is maintaining vascular flexibility. Blood vessels are designed to expand and contract constantly in response to blood flow demands. In diabetes, this flexibility is reduced due to inflammation, oxidative stress, and mineral imbalances. When vessels lose flexibility, circulation slows and pressure inside the vessels increases. This mineral helps regulate the balance between contraction and relaxation in blood vessel walls. By preventing excessive tightening, it reduces mechanical stress on the endothelium, the thin layer that lines the inside of arteries. A healthier endothelium allows blood to flow more smoothly and reduces friction that can damage vessel walls over time. Another key role is supporting nitric oxide signaling. Nitric oxide is a molecule that tells blood vessels when to relax. High blood sugar and insulin resistance reduce nitric oxide availability, which causes vessels to remain constricted longer than they should. This mineral supports nitric oxide production and signaling, improving circulation and oxygen delivery to tissues. Oxidative stress is another major factor in vascular damage. Elevated glucose increases free radical production, which attacks blood vessel walls and accelerates aging of the vascular system. This mineral helps reduce oxidative stress by supporting antioxidant pathways and stabilizing cellular membranes. Lower oxidative stress means slower progression of vessel damage. Improved circulation benefits nearly every system affected by diabetes. Muscles receive glucose more efficiently, nerves receive oxygen and nutrients, and organs like the heart and kidneys experience less strain. These effects don't happen instantly, but they accumulate steadily with consistent support. When blood vessels are protected, the entire metabolic system functions more smoothly. One of the most important effects is improved insulin delivery. Insulin must travel through the bloodstream to reach target tissues. Damaged or inflamed blood vessels slow this delivery, which worsens insulin resistance even when insulin levels are adequate. Improved circulation allows insulin to reach muscle and fat cells more efficiently, helping glucose move out of the bloodstream faster. This reduces prolonged elevations after meals and lowers overall glucose exposure to blood vessels. Over time, this reduces glycation and further vascular damage. Better blood flow also protects nerves. Nerve tissue is extremely sensitive to reduced circulation. When oxygen and nutrients are limited, nerve damage progresses more quickly. Supporting vascular health helps preserve nerve function and reduces the risk of numbness, tingling, and pain in the extremities. Kidneys benefit as well. The kidneys rely on a dense network of tiny blood vessels to filter waste. Diabetes damages these vessels over time, impairing filtration and increasing strain on kidney tissue. Protecting vascular health slows this process and supports long-term kidney function. Another often overlooked benefit is reduced stress hormone activity. Poor circulation increases physiological stress, which raises cortisol and adrenaline. These hormones raise blood sugar and worsen insulin resistance. Healthier blood vessels reduce this stress response, leading to calmer glucose regulation. By improving circulation, this mineral helps break the cycle where high blood sugar damages blood vessels and damaged blood vessels make blood sugar harder to control. This is why vascular protection is not optional in diabetes. It's foundational to long-term stability. One more benefit is improved microcirculation, the tiny capillaries that feed skin and tissue. Diabetes damages these small vessels first, which is why healing slows and circulation feels weaker long before major complications appear. Supporting vascular function at the micro level helps nutrient delivery, reduces tissue stress, and can make glucose control feel steadier over time. In the next section, we'll cover how to use this mineral correctly, including safe intake, absorption tips, and how to avoid common mistakes that prevent it from protecting blood vessels effectively. Protecting blood vessels in diabetes is not about quick fixes. It is about reducing the constant stress placed on the vascular system day after day. When blood sugar remains elevated or fluctuates frequently, blood vessels are forced to operate under conditions they were never designed for. Over time, this leads to stiffness, inflammation, and loss of proper signaling between blood vessels and surrounding tissues. This mineral helps reduce that stress by stabilizing the environment inside blood vessel walls. One of its most important roles is maintaining healthy vascular tone. Blood vessels need to relax and contract smoothly to regulate blood flow and pressure. In diabetes, this process becomes impaired, leading to increased resistance and strain. Supporting mineral balance helps restore more normal vessel behavior, allowing blood to flow with less resistance. Healthier blood flow reduces mechanical damage to the endothelium. The endothelium acts as a protective barrier and signaling layer. When it is damaged, blood vessels become more permeable to inflammatory signals and glucose-related damage. Over time, this increases the risk of plaque buildup and vascular narrowing. Mineral support helps preserve endothelial integrity, slowing this process. Another long-term benefit is reduced oxidative stress. High blood sugar generates free radicals that directly damage blood vessel walls. This mineral supports antioxidant systems that neutralize these free radicals before they can cause further harm. Lower oxidative stress means slower aging of the vascular system and reduced progression of complications. Consistent support also improves blood pressure regulation. When blood vessels are more flexible, pressure inside them decreases. This reduces strain on the heart and lowers cardiovascular risk. Over months and years, this protective effect becomes increasingly important for people with diabetes who already face elevated cardiovascular risk. Blood vessel health and blood sugar control are deeply connected. Many people focus only on carbohydrates, medications, or insulin dosing without realizing that damaged blood vessels make glucose regulation harder no matter what strategy is used. When circulation is impaired, glucose and insulin cannot move efficiently between the bloodstream and tissues. Healthier blood vessels allow insulin to reach muscle cells more effectively. Muscle tissue is one of the primary destinations for glucose after meals. When insulin delivery improves, glucose clearance improves, leading to lower and more stable post-meal blood sugar levels. This reduces prolonged exposure of blood vessels to high glucose. Improved circulation also supports liver signaling. The liver plays a major role in releasing and storing glucose. Poor blood flow and inflammation interfere with this process, contributing to high fasting and nighttime blood sugar. Supporting vascular health helps normalize this signaling, reducing unnecessary glucose release. Stress hormones are another overlooked factor. Poor circulation increases physiological stress, leading to elevated cortisol and adrenaline. These hormones raise blood sugar and worsen insulin resistance. Healthier blood vessels reduce this stress response, making glucose levels calmer and more predictable. Over time, these effects compound. Blood sugar becomes easier to manage, fluctuations decrease, and the body operates under less metabolic strain. This does not replace medication or monitoring, but it makes every other diabetes strategy work more effectively. Section 4. C. Why this matters for long-term diabetes outcomes. Buffer. One of the biggest mistakes in diabetes management is focusing only on numbers while ignoring systems. Blood vessels are one of the most important systems affected by diabetes, yet they are rarely addressed directly. When vascular health declines, complications accelerate, even if blood sugar appears controlled on paper. By protecting blood vessels, you are protecting nerves, kidneys, eyes, and the heart at the same time. These organs all depend on healthy circulation. Supporting vascular integrity reduces the risk of numbness, poor wound healing, vision problems, and cardiovascular events. This mineral does not work overnight, but its effects are cumulative. Each day of consistent support reduces inflammation, improves flexibility, and stabilizes blood flow. Over weeks and months, this creates a stronger foundation for long-term health. When blood vessels are protected, the body becomes more resilient. Glucose fluctuations cause less damage, insulin works more efficiently, and complications progress more slowly. This is why vascular protection should be considered a core pillar of diabetes management, not an optional add-on. Protecting blood vessels is one of the most important but overlooked parts of diabetes management. High blood sugar doesn't just affect glucose readings, it places constant stress on arteries, circulation, and the systems that deliver oxygen and nutrients throughout the body. Over time, that stress is what leads to many long-term complications. Supporting vascular health helps everything else work better. When blood vessels are more flexible and less inflamed, circulation improves, insulin delivery becomes more efficient, and blood sugar control often feels more stable and predictable. This is why focusing on blood vessels is not separate from managing diabetes. It's foundational to it. Remember, consistency matters more than quick fixes. Small, steady changes made over time can have a powerful impact on circulation and long-term health. Always monitor how your body responds and talk with your healthcare provider before making changes to supplements or treatment plans. If you found this video helpful, consider subscribing for more science-based diabetes education and practical strategies to manage blood sugar naturally. Take care of your health, stay consistent, and I'll see you in the next video.